There's never been a better time to have dementia. Dementia has never had as high a priority as it has now. It's been a real achievement to drive dementia from being one of the least thought about conditions in health and social care to being at the very top priority for health and social care systems. Dementia is a disease that affects a growing number of individuals. There are already 35 million people with dementia in the world, and we know that within a generation, those numbers will double. Dementia has an effect on societies as well as the individuals affected, as well as the families that are affected. In financial terms, dementia costs the world $600 billion per year. If dementia were a company, that would make it the largest company by turnover in the world, bigger than ExxonMobil, bigger than Walmart. If it were a country, it would be the 18th largest economy in the world. Dementia has a macroeconomic effect right down to effect on individual countries and the way that we provide health and social care, right down to its profound effects on individual families and the people with dementia themselves. At the moment, only 44% of people with dementia in the UK ever know that they have dementia, ever have that diagnosis made. And when it is made, it tends to be late in the illness, at a time of crisis, when it's too late to prevent harms, too late to enable individuals to make their own choices. And then from diagnosis right through to the end of life, there are discontinuities in the pathway again. There are things that go wrong for everybody who has dementia, things that go wrong for the people with dementia and things that go wrong for the families. But the brilliant news, the important thing, is that there are answers to each of these sets of problems. So we've done work to enable us to be able to measure quality of life in dementia, because we need to know what's good and what's bad and what helps people and what doesn't help people. So we've been able to develop the DEMQual system to be able to do that. We've used it to evaluate services for early intervention in dementia, so evaluating the Croydon Memory Service model has enabled us to generate an idea of what good looks like in terms of diagnosis, and also demonstrate that such services are both clinically effective and cost effective. And that's enabled the implementation of those service models in the UK, but also across the world. So in Japan, in their Orange Plan, their national dementia strategy published this year, they're establishing 4,000 teams along that model throughout Japan. We've also identified harms to people through drugs, such as antipsychotics being used for behavioural disturbance in dementia. Those drugs are associated with 1,800 deaths per year. We were able to demonstrate that through good quality, systematic reviews of the evidence. And we formulated plans that have been implemented throughout the NHS that have led to those drugs being decreased. The use of those drugs is now half of what it was in 2008, which means that 900 lives are being saved by the changes that have been made in the system. So we can change public attitudes and understanding, and that's already starting to change. We can change professional skills and understanding, and that's already starting to happen. We can develop services to enable early intervention in dementia and to enable all who need to be diagnosed, and that's starting to happen with the development and introduction of memory services, both in the UK and worldwide. So great stuff being done for people in people's own homes, brilliant work in general hospitals, fantastic work being done in care homes right through to the end of life care. And it's that agenda of applied health research, which is the work that we're engaged in here in the Centre of Dementia Studies at Brighton and Sussex Medical School.